Radiation exposure from nuclear weapons tests a reality for a number of Arizonans, especially on tribal lands. Tonight, a renewed push for financial support for the victims. ABC 15's Jane Caffrey speaking to one woman about why this mission is so personal.
At the nation's capital, tribal culture is on display. But the visit to Washington is a solemn one for Carrie Sikayamtua.
It was difficult for me to even consider doing this trip because in my normal life, I am housebound 24/7.
She says she started developing dozens of illnesses starting in her late 20s after growing up on Navajo and Hopi lands near nuclear testing sites and uranium mines.
I've had cancer twice. Fatty liver disease is now stage 4, which means that if I don't get a transplant, my disease is going to be fatal.
Sikayamtua is one of 50 or so tribal members who traveled to D.C. this week, pushing Congress to pass the Radiation Exposure Compensation Reauthorization Act, or RECA.
This bill would extend the period for those who have been exposed to radiation to apply for compensation.
The Senate passed RECA back in March. Now the sticking point is in the House, where Republican leadership says the bill would cost $50 to $60 billion over 10 years, with no policies to offset that cost. However, RECA gets support from 2 Republican congressmen for Arizona, Rep. Paul Gosar telling us the United States government poisoned its own people, and Rep. Eli Crane saying our government owes a tremendous debt to those who sacrificed their health for our nation. For Sikayamtua,
my children have only known me being sick.
It's legislation for a community she views as life-saving.
We shouldn't be dying while we're waiting to receive help. We shouldn't be suffering.
Jane Caffrey, ABC 15, Arizona.